Welcome to the Deep Six podcast, where we make a generational impact on you and yours. What we do here is explore a 6-point model into your health, your life, and your journey while you're here. So let's dive deep and help you thrive, not just survive. Hello, welcome out there. Hope you're well, and welcome back again. And again, I have an amazing guest and grateful for it. It's actually one of my mentors and teachers, and we're going to dive into some really exciting things that are like integrative cancer, new and interesting alternatives, if you will, or complementary treatments to cancer, experience in hormone medicine, experience in thriving, just like we talk about in the 6-point and the Deep Six here. But welcome, Mitch Ghen, Dr. Ghen, Mitch Ghen.
Oh, thank you. I like the deep six idea. Six
Yeah,
points.
6
What
points,
happens
man.
but if I add like 4 more points, will you increase it to the 10 points?
Well, if you
I'm just
haven't
kidding.
noticed, here, listen, we all have short attention spans, including myself, so we probably won't add those, but we'll talk about them.
All right.
Yeah, but hey,
Thank you
by the
so
way,
much.
there's way more than 6 points, obviously, to health and wellness and, anti-aging and thriving and all that. But I found in my practice, and hey, listen, off the cuff here, tell me your input, but if you're not addressing genetics, you're not thinking of hormones, you're not thinking of gut health and nutrition and toxins and detoxifying and mind and body connection and structural things, that's the 6, right? If we're not addressing those, what are we addressing, right? We're going to miss things, right?
Oh, I agree. Yeah,
Yeah.
you definitely have to address all of them as not mutually exclusive, but mutually inclusive if you want to do a good job. No, I like your title. I'm just
Yeah.
teasing you, of course.
Well, you give it to me. You've always given it to me, even in lectures and conferences, and I'm way in the back trying to hide from you. You've done that to me. I love it. But
Of course.
let me
Someone's
give
got
you
to be the whipping boy, right?
yeah. Well, let me give you at least a slight proper introduction, because listen, you're 38 years of experience, okay, in
Actually, it's
anti-aging and
44 now, believe it
oh,
or
now it's
not.
44. Okay, all right.
Yeah, I
Well,
mean
look,
you're 6 years back. No, it's
yeah.
actually 44 years, believe it or not. It's
Wow,
crazy.
44 years. Yeah.
Crazy.
Well, you got to update your website.
Okay.
No, but anyway, but listen, no, I'm just joking. But yeah, 44 years in integrative medicine, holistic medicine, anti-aging, if you will. In fact, actually, that's where I met you. You were my IV, mentor, if you will, and I got certified in IV therapies at A4M and personally through you and some of your teachings and classes and stuff that you do. I mean, you bring a wealth of. I know you're a DO, but you bring a wealth of experience also in nutrition. You're a PhD in nutrition, correct?
Yes.
Yeah, yeah, and I know you're an international speaker. Again, I could go on and on. Why don't you tell us a little bit too? But like one of the questions I have though, because I don't think I've ever actually asked you or talked about this. How did you get into this from obviously your background, traditional medical approach?
Actually, Jim, it happened pretty much my first day of internship. I was in a internship where I was the chief intern of this particular group, and I noticed over the very first weeks, if not months, there was a group of internists that got people out of the hospital faster than other groups, sometimes 3 or 5 days quicker for the same exact ailment. Now, if you want to be good at what you do, it's always good to question, okay, what are they doing that's working? I'm learning.
Right.
I'm learning resident, so I want to know. And the answer to it was that they were using, and this is 45 at least years ago, they were using in the hospital 50,000 milligrams of vitamin C intravenously. So I
Love it.
said,
Love it.
yeah, that's how long ago. And I
Yeah.
said to myself, there's something I didn't learn in medical school. The traditional medical school curriculum, basically. And I recall this. When you have physiology, for the folks listening, that's a function of the human body. You have a lab that's associated with. One of the things we did on one of the labs was, okay, everyone go get their urine. Now everyone take 500 milligrams of vitamin C, wait an hour, go get your urine again, and see at the end, the thing that was supposed to be noted, was that, look, almost all of that 500 milligrams is in the urine. And so the conclusion, at least of the school and the physiology department, was it's worthless. It goes in, it goes out. What they were missing, which I had to learn through the experience that I just talked about, was hey, there is a physiologic effect, not necessarily tied to the life of it in the system. So, whereby, for example, we're talking about IV vitamin C, half life is about 30 minutes. That's all. That's why you shouldn't give it fast. It should be given over time. However, its effect of the human body to the white blood cell, to the immune system in general, is up to 3 weeks. And
Yeah.
that's the piece that I was missing back then. And of course, it's a learning curve to get there. But that one experience was enough to say, you know what, Mitch, you need to look into things that you weren't taught in medical school. I have a completely different insight, obviously, Jim, than I did back then. But now I
Yeah.
realize, we're pushed and pigeonholed into one thought, and it's very, very different. And to go on, and I know you might want to ask me other questions, but I'll let you talk in a minute. I know you're the
No, no, no.
host.
This is exactly what you just explained is exactly what happened to me. And I'll be real brief because I've said it in other podcasts. But you probably don't know because you met me along the line. I think it's been 12 or 15 years ago or something like that, at least once. But I was a GP, just doing regular GP medicine, and what I didn't like is kind of things weren't working. I wasn't helping people. Yeah, curbside stuff, treating them. Here's your antibiotic. Here's this drug. Here's your blood pressure. Here's this. And I'm running a mill. And, the reality of it wasn't fulfilling to me and I wasn't making a difference to them. And so for what I went to school for and to do, it wasn't good. It just didn't feel right and it wasn't right for them. And I went to A4M, American Academy Anti-Aging, functional medicine, stuff like that we talk about in practice. Somewhere along the line, that's where I met you. But I went to one lecture and that put me right back in a mindset because it was so interesting, the physiology, the functionality of the body. And I'm like, shit, how do I not know this and use this in my practice, even though I had learned it in medical school? And
Sure.
literally right away, it was like a shift into my approach in medicine and patients. And, that was 15 years ago ish. And so, made a huge difference. I mean, patients, get better, feel better, how rewarding for me, but also, have a purposeful life and to, kind of implement something good and positive in them is so rewarding. And I know you do this, I mean, every day.
Yeah, well, when you come out of medical school, you have this ideologic feeling you're going to save the world. And I was fortunate enough to learn that so early in my career that, wait, there may not be that. And unfortunately, most of the things that we do that you and I know in the Western model, which is the typical medicine we call allopathic medicine, is a band-aid. And it's the type of education we're given is sort of pigeonholed towards the if you get this, here's the medication, and that's a whole another talk at another time why that tends to occur. But you start to realize that first week of medical school, the second week or the second semester even, when they're talking about biochemistry, and I always say you need to really know two things to be able to be sitting out of the box to help a patient. What's the patient's biochemistry? What's the patient's function? And the biochemistry I always look at, and I tell doctors, and I just taught this weekend, doctors from all over the country, including cardiologists and different subspecialties, just look at the cellular cycles and what our body requires to make that which keeps us alive. Now, we stay alive because every cell, whether it's animal or human, has to make energy. ATP, as you and I know, it's a
Yeah.
triphosphate bond. If you want to call the gasoline ATP or adenosine triphosphate, you don't need to remember that, folks, but you need to know that without a cell making energy, that organism or that cell won't live and the body will kill it or something else will occur. Well, part of that, if you look at the pathways, I'm talking the cellular pathways, it's very clear those pathways need magnesium, they need essential fatty acids, they need manganese, they need vitamin C, they need essential fat. It goes on and on and on. And if you look at the pathway, which I always do, and I'm sure when I talked to you as well and instructed you, I showed that too, to basically say, show me in this where there's any medicine. There's not.
Right,
There's
right.
these nutrients. And so we learn the cycle. We get tested on the cycle
Oh
the
yeah, the Krebs
first month,
cycle.
and you better know it because they'll
Right.
ask you any point of this. You memorize it, you take a test, and 95% or more of physicians will forget about it and they'll never go back to it and use it again because now they're under that if then type of thought process. So, yeah, I was in the same position.
Yeah.
And you're lucky because you're so bright. I mean, you came out, you made that recognition. Not everyone is able to connect the dots. Lots of people, but it's changing. I have a massive amount of healthcare practitioners. I say it's hundreds and hundreds of them that see me when they're not well. I am now
Oh,
training
listen, yeah.
people. You know,
You are, no, and just for the listeners, the number one person, I had long COVID. I mean, that's what we call it now, but, I had a basically post-COVID immune suppression. I'm over it. I did some things, that were in my toolbox that I stole from Mitch's toolbox. So thank you, sir. But who did I call first? Dr. Ghen. I called you, buddy. And I just
yeah.
like, something ain't right. The world's weird. I know what's going on. And one of the, after I got lectured about Michigan versus Florida and us being locked down, and you're 100% right. But I'm like, I can't do much about that right now. But listen, I feel like shit. Help me out. But yeah,
Well,
no, but,
yeah,
but you were the first person I called. And I do want to say this because I don't want to skim over this, because this is every time, if you pick up, the phone, text me, whatever, or one of your staff, and you got something where you're speaking at or having, call it a little mastermind, you know what I mean? I'm on a plane and I go there, okay? I've sat down, I want to tell the audience this, I've sat down, and there's people from multiple countries, Africa. I remember meeting a gentleman from Africa, a physician, So, people are realizing around the world the benefits of the physiology, the biochemistry, and fixing those things, and how the cookie cutter Band-Aid medicine, if you will, doesn't always work. And people are seeking more, and these things work. And you're one of the forefront, I believe, people in this. And I thank you. My patients thank you. But I just want the world to know that you lecture, and all the audience out there around the world, and you have people come to see you from around the world, and even physicians, like you just said, myself. Who do we go to? You.
Thanks, Mom. I appreciate it.
Yeah.
You know what?
You
Yeah,
pay me
Jim,
later. Pay me later.
Okay. Just to bring everyone up to date, last week, ABC News, local news, came and interviewed me because there's a wave of people that are heading towards integrative medicine. They wanted to find out what is that wave. And I explained it. Now I would like to explain it because I think the folks watching the podcast would get a good idea. And may I do this and give an
Oh,
analogy? Because
please. No, please. I love it.
okay. So the analogy I use nowadays is if you take your car in to be checked and it was 30 years ago, I was driving 30 years ago. They picked up the hood. They looked to see if there was oil splatter. They changed the air filter back then. Checked the water in the windshield washing thing. It doesn't work that way now. When you take your car in, they hook your car up to a computer and they do about 155 checks, and it's done pretty much automatically simultaneously. And the reason they do that, of course, is because it's more sophisticated. The cars are more sophisticated. They can find a problem quicker, and typically it's not really a fix. They pull out the part and put it in, but that's beside the point. And the question is why? And this is what I think the folks need to take away is why is it that when you go to your family doctor or your traditional internist, exactly that's what's happening too. They'll get blood tests similarly, of 4 or 5 common things, maybe a blood count, a complete metabolic profile. Some are getting smart and will do a vitamin D, but still don't know what to do with it. We can always talk about it. A thyroid profile. And I'm saying no. You need to do that 155
Yeah.
comprehensive check. So when someone comes to me, and I know they do with you now too, you've got to look at that biochemistry and the functioning. Functioning tests or something we could talk about later if you choose. But the biochemistry can only be determined by doing a deep enough dive, by doing 140, 130 tests on this individual's blood that gives you a hint. And then if you need to go deep dive 6 further, you certainly can do that. It makes more sense. And by the way, it makes sense pretty much to any physician that will sit down and take the time. Like the group I lectured to a group over last weekend of doctors and healthcare practitioners, a couple nurse practitioners, about this kind of concept that we need to look at things in much greater depth of the biochemistry and physiology that we're doing in the typical practices if we want to really make things change. And the truth is, if we can see, just like with the car, if we could see these subtle changes occurring early enough, we can fix them. I always tell people I don't look for things I can't fix. So if we could see a little tweak here, a little tweak there before it becomes a problem, then that will help the person not only be healthy, reach optimal health, not just normal, but optimal health. And if they're already coming with an issue, it's much easier for you and I to handle these issues. So if you're still going to a doctor, folks, that does the typical things that I said earlier, maybe 4 or 5 tests and tells you, oh, your cholesterol's high, and oh, that's everything's fine. Otherwise, you're probably in the wrong place. And I would highly recommend, to seek out someone like Dr. Jim, who will do a much deeper dive, who's going to take the time to determine who you are. Because we're all different. We need to know
Yeah.
each
Yeah.
other's individual biochemistry. And I think
Yeah.
that's an important takeaway.
Yeah, and I think it's very important to understand that there's something that not just obviously my practice, your practice, but an integrative practice, a functional medicine practice, somewhat, if you will, as long as it's quality, holistic practice, is thinking of you individually and as a whole, because
Right.
the mind body, the genetics, the nutrients, all these matter. Now when you were talking, by the way, you just made me think of something, because it put two of these together about the ATP, the Krebs cycle, and energy, and something that just happened in my practice. So I just want to share it, because it literally, I mean, this is days ago. I had a gentleman that had in his 60s, little bit of heart disease, a little bit of some, calcium in his arteries, a little bit of tests on some autonomic tests that we do that we could see stuff. I had him on a program doing very well. And this, but, for his comfort, he has a cardiologist in the past that basically is, giving him the Pope blessing, I call it. He's not really doing much, because, we're doing all the IV chelation, nutrients, working on his, mitochondria, working on his endothelium of his vessel, all these things. But here's the thing is, what did he talk him into? Made my patient feel, anxious. I got to do it. So he goes on a statin for 90 days about. I see him in the practice and he's tired, he's weak, his muscles ache. And I said, are you at least supplementing CoQ10, which is huge in the Krebs cycle, which is, I think it's cytochrome, I don't know, 3 or something like that. I can't recall the science physiology exactly. It's not as big as NAD in the Krebs cycle, but it's a big one. And he goes, yeah, my cardiologist said, yeah, you can take some, whatever. You don't really have to unless you get muscle stuff. It is so huge that when this gentleman who I said, well, you got to supplement at least 300 milligrams. We probably need to test you and even supplement above that. But if we're going to stay on, and he's anxious, he wants to stay on a statin, et cetera. I gave him an injection of CoQ10 intramuscularly, put him on the right dose. He texts me 48 hours later and told me that he hadn't felt that good in 6 months, a year. So, I mean, looking at the physiology, the chemistries, and not just band-aiding something that probably would potentiate a problem further down the road, is what integrative or functional physiology medicine is, right?
Oh, yeah. And by the way, the drug companies knew about the robbing of CoQ10 with the use of a statin drug since the very beginning. The very first statin drug that we had in America was Mevacor. I believe the Japanese called it Mevastatin.
Yeah.
Mevacor actually has had, I don't know if it's still there, at that time, they patented not only the drug, but the drug with CoQ10, but they never exercised that patent.
Oh,
They never brought it up. They knew about it.
they
So
did. Yeah, I
it's
didn't know
not,
that.
oh, yeah, it's not that they didn't know. It's just that did they care
Yeah.
enough? Was it important enough? And
Right.
there are amazing writers. I don't want to get started on statins because I'll do 1 hour tirade on why
We'll
not to
come back
take
on
them.
that. I know. I know.
Okay, so, and I have to tell you, just as an aside, because it's funny, I told you this weekend I was teaching. I had a interventional cardiologist and a
Love
regular
it.
cardiologist
I
in the
love it.
group. Do you know how I started off this whole
Oh,
thing? You're gonna
oh, I
die
can't.
because you know
By the
me.
way, blood pressure for those two guys was going up. Did you get, by the way, did you give him some, some nitric
I
oxide? You give him some Berkeley Life?
I probably should have because
You
you know
should
what's in
have.
my head is on my lips, and I don't care because anyone could go ahead and try to challenge me, and they're in the wrong playing field if they're going to challenge me in my field. And theirs, of course, not. But I said, look, you know, I asked everyone, Jim, why are you here? We want to expand, you know, and the cardiologists I listened to very careful. They said, well, we want to expand it. I think we want to do some intravenous things to prevent. I said, good, 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 good. So I just want to tell everyone, and specifically you two cardiologists that are in the room, that to be able to do that and enter this wellness space, you're going to have to do a couple of things. And they said, what? I said, one, you may have to relook at your belief system. And two, you're going to have to put your ego and bias on the shelf. Now, I know I'm asking a lot, but can you do that? And they're thinking, oh my gosh, Mitchell, what do you say? I said, look, let me start off with something easy. So I started off with, and I won't say in the program just in case you want them as a
Yeah.
sponsor one time, one of the statin drugs, which I know inside out, they're all the same. I brought the PDR, the actual
Yeah.
desk reference, and I had made copies for everyone.
Yeah.
And I
Physician's
showed,
desk reference that basically, so for the audience, gives all the safety, all the data, all the science, all the background on it. So sorry, go ahead.
and the part is, folks, no doctor ever reads it because they're 6, 7 pages long. They'll reference to it once
Yeah.
in a while, but 5 to 6 pages buried in there. It literally says, and I'll try to explain a little bit, that the relative risk improvement for taking this drug is about 44%. Now, that what they're trying to say in this article is basically 44% of people are going to get a good result from it. Now, that's a total lie. And I told the cardiologist that's a lie because its relative statistic, without going into it, is not based on a proper statistical model. It's actually done purposefully. But in any case, in the same sentence, they said it was significantly improved. And then just 4 words like, and the absolute risk reduction
Mm,
was 1.2%, which, by the
yep.
way, folks, means it's a 98 point some 8% failure rate. And it's in there, but it's buried so deep. Doctors don't know it. They don't read it. And I showed it to them. You know what
And what would
happened on the
anybody? Oh, go ahead. Go ahead. No, go ahead, please.
first break? And I certainly will use my nice radio, not any type of bad language, which I pride myself to be able to do without that. The cardiologist came up to me and said, you know what, Mitch? This is such horrible,
Yeah.
you know what, that we go through and we're trained and da da da. And I said, that's right. I said, but
Yeah.
here it is, it's your own. And
Yeah.
then later on, I brought an article by a very famous non attached to the pharmaceutical industry researcher Okayama, which I think I've shared with you before, Nakazato. But in any case, it
Yeah.
was great.
Oh
It
yeah.
was
No. No.
great to watch. And everyone,
Oh
my
yeah.
wife calls me, Irina calls me, my wife calls me later, goes, do you still have the cardiologist in the room with you, sweetheart? I said, yeah, it was really good, honey.
Yeah.
I was
Yeah.
sweet. I did it
Yeah. Oh yeah.
nice.
Yeah. Yeah. It's beautiful. They.
Now they're totally on my side. They realize,
Oh
and
yeah. Yeah.
any person who will drop their bias shield for 1 second and
Mhm.
realize there could be some. Look, I told him the same thing. In integrative medicine, there's got, you know, plenty guys. They learn one thing on one day, one on another, and that's the best, and they're doing it,
Yeah.
and all that kind of stuff. And I
They're
use the
married to their
example,
answers. They're married to
and it's not,
answers, not the
and
future of
that's
forward
and it's a
thinking.
belief. Yeah,
Yeah.
there are many studies in psychoneuroimmunology, which my PhD is in, where people, whatever your belief is, it's very hard to get rid of it no matter what you do. And these
Yep.
guys, I was able to break that down in a very short time. And I was proud of doing that because I think I did it nicely. And it's important that they realize it. There are doctors that will hold the belief even long after the time. And unfortunately, that's the problem with a lot of things that have gone on in the past couple of years, you know, with all these diseases that showed up. The doctors sort of parroted the things of the talking points of this industry, the medical industry, and it's hurt a lot of people. So
Yeah.
it's
Yeah.
good
Oh,
to
yeah.
see when
Yeah.
I wake up someone, it's a thrill for me.
For
But I
sure.
started to say
You're making
people
a
learn
difference.
different. It make a difference when I help. If I help you and you help 50 others, oh my goodness,
Yeah.
that's amazing.
Yeah.
But what I was saying is how people pick up one thing over here, even in our own industry. A cheap example is red yeast rice. You know, people, oh, some doctor, oh, my doctor's nutrition, he gave me red yeast rice, except it works just like a statin. It causes
Yeah.
CoQ deficiency and all the other things. So, folks, I'm not saying that you shouldn't do one way or the other. It's always best to do that which is the least invasive, the most biochemical for your identity, the most physiological that gets the job done. That means we use regular medicine right next door to integrative medicine. And
Right.
if there's something in what I do that's not working, I assure you, I'm dropping it from my vocabulary. I
Yeah.
don't have to be ego attached to anything that I do. If it doesn't work, bye bye. We go on
Move
to the
on.
next thing.
Yeah.
That's all.
And
I thought I should bring that up.
no, no, you're spot on with so many things. And this, I'll just leave with this about statins. I, within the year, had an insurance company contact our practice. I didn't talk to them. My managers dealt with it all. And they were going to pay me $200 each prescription for each patient per year for statin use. So they're incentivizing me. I don't know how they do it. I don't know what it was just like, whatever. I mean, I laughed, you know what I mean? But
Uh,
meaning either you're going to incentivize physicians to do something. And anytime you do that, you know, now they're not thinking of you. You know, they're sitting in front of, you know, you're sitting in front of a physician that might not be thinking of your best interest. And then just like their data that you just said, that's buried 5-6 pages deep, has a 98, whatever, 0.2%, you know, failure rate, you know, so we'll leave it at that.
Yeah,
We'll
I
leave it at
just
the
will. I'll just comment on. I think that concept of doing that. I know you push them away is disgusting, and
100%.
it's exactly if you look at what RFK Jr. is trying to do now. It's exactly what happened with the pediatricians that make tons of money for every immunization they give. Doesn't
Yep.
matter if there's an
Yep.
issue. I'm not talking about that today. You'll hear a lot more because JFK is going to take a prominent position in the new administration. But the truth is, it didn't matter. Millions of dollars from these companies were paid to these pediatricians. It is wrong. The only
Oh,
thing that we
100%.
ever should be
That's
doing,
why they're
we could,
kicking. We're
you know,
kicking. So I don't know how it is in Florida, but in Michigan, they are. Because we don't do pediatrics, obviously. And if somebody's, you know, teen or preteen, we do some gut health and some food allergy stuff with some of my other practitioners. We'll do with them, but we obviously that's not my space. So every family member, every patient's always asking, "Who do you? Oh, where can we take our kids for your type of approach in pediatrics?" Because we've been kicked out. I say it again, kicked out of their pediatric practices because they didn't do vaccines or they wanted to limit the amount. So they wanted to have the autonomy to say, you know what, I don't want 5 vaccines today. Maybe we'll do 1 and I'll come back in 6 months. But they were literally
exactly.
discharged from the practice.
Not unusual. I hear about it down here all the time too, which again, folks, should we talked about look for a new doctor if they're not doing a deep enough laboratory into you. And if they say, oh, you don't need it or you don't know, but it's just because they're ignorant of it. They just don't understand. But again, if anyone is trying to force feed you into any specific thing, whether it's for a child or an adult, this is it, you have to do it. and they can't provide, and you can't provide yourself with a very good, rational, logical, well done studies, don't do it and change your doctor. It's
Yeah.
very important.
Yeah. Amen. Amen. So I gotta divulge into something that is really in your space. I've actually sent you patients, even loved ones, and you do a very unique model that I think is one obviously super needed because of the rates that are going up, which we can talk about, but is in cancer therapy, integrative cancer therapy, repurposed medications for cancer. But enlighten us a bit on that, and I'll tell you, you educate me a lot on that, and I help many patients in my practice. But obviously, I try to funnel them to you because it's your expertise. But tell us kind of what's going on in that space and how it makes such a difference and why.
Well, in the normal, or what we call the conventional oncology space, I think people are pretty much aware that the tools that the oncologist has, or the community of that, are either surgery, radiation, or chemotherapy, depending on the stage and so forth and presentation of that particular cancer. Um, what's left out of that equation, unfortunately, is the fact that there often, more often than not, are cells called circulating tumor cells that break off from the initial tumor, including breast, prostate, etc., and they roam around the bloodstream. Now you can imagine there's no chemotherapy that will kill them. There is no radiation unless you radiate the whole body. You can't do that. There wouldn't be an immune system. And of course, there would be no surgery. You can't cut it out. So, with that in mind, we look at cancer as a metabolic disease. And as a metabolic disease, it goes back to what we were talking about earlier in the podcast, that when the cell does not make enough that ATP or energy, the body will either strike it out, which we call apoptosis, will destroy it, or the body may allow that cell to hijack the pathways. And we were talking a little bit about that Krebs cycle you mentioned, where we get to that good amount of ATP, and instead the cell ferments its energy. So normally under normal conditions, we'll make 36 ATP. That's the healthiest. Diabetics make less. I mean, heart disease, but close to 36. If the cell is not killed and it ferments. Now, in plants, if you have wine or grapes and it ferments, you get wine. In a human, if a cell ferments, it becomes lactate. Some people know if you lactic acid, that's if you move a proton, you get lactic acid. That's why people say, oh, cancer patients are very acidy. That's one of the reasons. That only makes a small amount. It makes only 2 ATP. So you could say, Mitch, that doesn't make sense. And it does because simultaneously the cancer cells upregulate how fast it's bringing sugar in from one molecule of glucose or sugar. And it upregulates on these cancer cells the amount of insulin receptors. So it sucks in the sugar as fast as it can. I use the analogy of like a supermarket. Under normal condition, one truck of fruits and vegetables come in every day. Maybe there are 2 people to take it off. Now you have 50 trucks coming in. You have 80 people. So you're making it so fast, this energy, so the cancer cell can sustain itself. You're making about 200 times faster. And so does some of the byproducts of proteins, amino acids. We don't have to get into that. So a metabolic approach is to try to cut this pathways of fermentation, whether it's amino acid or it's sugar. The purpose of using a metabolic approach is to block these circulating tumor cells. And you can say, well, how is it done? Do I have a moment to talk
No,
about that?
please. No, no. Yeah, absolutely.
Okay,
Yep.
so the method to do that is a sort of piling things on top of everything. One, there's no question there are nutrients and things that people can take that will help break these pathways. Number two, there are intravenous things. People have heard of intravenous vitamin C. They've heard of ozone. Maybe they've heard of dichloroacetate. There's lots of things that we can use intravenously to also help precipitate this cutting of this fermentation process. Then we have something that you mentioned, which Dana Farber, Harvard, and MIT looked at about 2014, about 6,500 older drugs, the 60s, 70s, 80s, 90s, early 2000s.
6,500. You said
Yes.
6,500. Okay. Wow.
Yeah, they looked at 6,500. They found at the end of the day, only 50 of them could really muster the same response. And you could see literature. And by the way, these drugs are not supported by the drug companies because almost all of them are now generic. So just so you know, this was not drug company pushed. So there's about 50 drugs. They're in different categories: antiparasitics, cardiac drugs. They're in different categories, anti-inflammatories, that each have a proclivity to block some of these pathways. And by utilizing them and putting that on top of each other, and we also use something like near infrared and molecular hydrogen. We can get into it if you choose. But at the end of the day, we're trying to do something that's really much less invasive, much less making anyone sick for sure, and hopefully getting an excellent result. So
Yeah.
I always tell patients you have four choices if for cancer. One, you could do nothing. That's your choice. Two, you could do the conventional things, but recall, you can't get those circulating tumor cells, and rarely does the oncologist look for them. The third is you could do just this type of approach, or four, you can do both simultaneously and try to get the best of all worlds. And
Yeah. And
that's
I'll,
how
I'll
so I
say
tell them.
in my input, in my experience, and by no means this is any medical direction at all. I'm speaking very openly, generically speaking, is that I tend to see in our practice more of the integrative approach, meaning number four, both approaches. They're having an oncologist, they're having some approach there. And obviously most of them, I think part of it is they believe in it. And a lot of times believing in your choosing, I think there's even a study on this by Bruce Lipton, or it's in his book, PhD Bruce Lipton, great guy, great interesting guy, great scientist, and is that you believe in that therapy, so you should probably go with it, okay? But also then integrating some of these non-traditional, complementary, integrative approaches. That's what I notice in our practice where people tend to do the best.
Well, they will. And not only that, but it's huge amounts of people flocking to it now. There is so much more cancer now, and
Yeah.
especially the younger groups,
Oh yeah.
there's massive amount of cancers that are occurring.
Well, and the
So
rate the
there's
rate
no,
alone of head and neck cancer in my entire career, even in ER medicine and residency in downtown Detroit, I could say on one hand how many times I saw head and neck cancer. In my own practice right now, I have a handful of them. That
yeah.
is, and I know the rates are like actually up 5 times in head and neck cancer. It's just that just mind boggling to me.
Yeah, and for
The
good reason that rates up. But you're seeing so many of these, Jim, of these cancers, and people need to afford themselves of everything and every possibility. Um, Unfortunately, many times the treatments we use in the conventional treatment model is nasty failures. There are lots of harsh side effects. And again, we can also, from the integrative component, mitigate some of these side effects they're having,
yeah,
so they can do both programs
and do
pretty
better.
much side by side.
I just want to. They can do side by side, and they can also when the oncologist I tend to see is done with you, they're done to you for 90 days or whatever till the next PET scan or the next CT or MRI or whatever. Okay, and they feel like horrible. Their DNA's damaged, their immunity's damaged, their metabolic system, their energy's horrible, and then they have anxiety from going through all this PTSD stuff. That just has just happened, and if and often that's where a practice like ours can come in and, help them and help lift them up in many ways and help their immunity and help them regenerate, et cetera. So one thing I just wanted to
Exactly.
say for the audience, because I had this discussion with a patient fairly recently, is that most medications in the U.S., and I'm not talking now about cancer, I'm talking just in general, most medications in the U.S. are off-label, and meaning that they have many physiologic purposes and functions in the body. And what I love about all these meds, these, did you say 50 or 55 meds that were repurposed out of the 6,500? I think that's what you said, right?
Yes, yes.
So yeah, well, those, I mean, and the ones that I'm aware of and I use occasionally in patients, the amount of side effects is so minimal to none. So, and very cheap because they're generic. Okay. By the way, one being aspirin, one being ivermectin, one being a beta blocker. I mean, there's so many I can mention. They have so little to no side effect that it's like, why wouldn't we use them? And they're cheap.
And if there is a side effect, it's nothing that can't be quickly
No,
resolved.
resolved in
Right.
days, or just stopping. Exactly.
Yeah,
Yeah. Yeah.
exactly.
So I do want to touch upon two other little things. One is huge because you just, brought this to me. I think it was maybe a couple of years ago. I was at a conference with you and introduced me to molecular hydrogen. And I have used it. Successful is not even, it's an understatement. In people, we, do it synergistically with our IV therapies and stuff. But would you just give me a little insight into, molecular hydrogen? Also, what I love is you told me that in other countries, they've been using it for years.
Oh, it's true. Well, folks, the thing we do know are there are certain things that we call medical gases. Everyone knows oxygen, and that's a no-brainer. What you also might know, if you have sat or you listen to Dr. Jim pretty much regularly, is that ozone or O3 is also considered a medical gas. Now, what's become of age recently is the use of molecular hydrogen. Now, hydrogen is the number one element abundance wise in the universe. It's the smallest element. So when you use this particular element, it goes everywhere. It's the element of really creation. Hydrogen, water is H2O. We create by using hydrogen. And that's exactly what hydrogen does. Now, we use it as an inhalation product. There are amazing machines. Am I allowed to say a machine name or is that
100%. No,
okay?
no. Yeah. Yeah. I have
Oh,
four in
okay.
my practice.
Yeah, okay, yeah, we do too. Hue Light, which I happen to be the chief medical officer for, HUELIGHT USA, and I have one in my home. We use it every night, my wife and I. When you breathe in this hydrogen, it's in the system for about an hour or so. But again, it's exactly what we talked about vitamin C earlier in this podcast, and that is its physiological effects are days
Yes.
afterwards.
Yeah.
And what it does, one of the major effects that hydrogen's breathing in does is it initiates in the mitochondria an area that actually produces our antioxidants. And there are two specific antioxidant type of things that it produces. One to block what we call the hydroxyl, and the other is the peroxynitrate free radical. Doesn't matter. You don't need to know the names, but you need to know those two are the most aggressive. So by using this, not only is it giving you much more antioxidation, it is helping the body to create apoptosis, but to modulate it so it's occurring properly. It is anti-inflammatory. So what could be better than breathing this? Now, somebody out there's probably, well, wait, I have one of those hydrogen things that bubbles and I drink it, and my wife had one of them too.
Yeah. I
Except
get
when
asked
you,
that too. Yeah.
so it's probably a good place to tell you
Yeah. It's
if
cute.
you want, it's very cute, it's adorable.
Yeah.
If you want to drink the hydrogen, God bless, do it, but be aware that 1 hour of breathing in, or even a half hour, let's say a half hour of breathing in the molecular hydrogen, you would have to drink, are you ready for this, about 12 thousand glasses
Yeah.
of these molecular
Right. To make a
hydrogen
difference. Right.
to make a difference.
Yeah.
So
Yeah. Which would be
this is,
toxic alone by just the water effect.
yeah, I think. So yeah, I'm going with and that's what this molecular hydrogen does. That's why you have 4 units. It's so wonderful as an adjunct therapy. And again, you're layering therapies. When we're
Correct.
doing physical biochemistry and physiology functionality, which I've said now the third time during this podcast, you want to try to fix the everything pretty much simultaneously. That if then, oh, you have cholesterol, here's a medicine. Oh, you have diabetes, here's a medicine. You know, the idea is to fix all the chemistry as best you can so that you get a really good optimal outcome. And that's
Yeah.
why these gases and all the things that we're talking about fit in so wonderfully together.
Well, medical gases, period. Like, because I used to use hyperbaric in the practice, still do a little bit, but we kind of just from semantics and we actually farm that out a little bit. But long story short is, if I get a patient with migraines, acute migraine, their prodromes coming on. If I have somebody with post-viral, even COVID in the past, brain fog. If I have somebody that's, kind of just cognitively not sharp because of whatever's going on, stress effects, adrenal effects, maybe they're getting an IV or whatever, but I'll put them on molecular hydrogen for an hour while they're doing their IV, or they might be even just, taking some meditating type of breathing and stuff in the lazy boy. And they are instantaneously better. And I know that's a big statement, but literally headaches will resolve in literally 10, 20 minutes. People will feel a huge difference walking out the door. And like you said, it has lasting effects too. But I mean, this says a lot. These are expensive machines. Okay. Hue Light. Okay. HUE Light USA. I'm not paying me to say this, but I'm saying this is how quality they are. I had a machine. My IV nurses are going, hey, doc, they're poking me. Hey, people are fighting over these. Can you get another? After two became four because it was just, we had to, that's how effective they are is, it's just not the one-off, So, by the way, thank you again for educating me on that and enlightening me on that. One last question I have for you before I let you go, because I know you got to get back to the sun there down in Florida. Yeah. And we're a little jealous because we've had great fall here. We have beautiful, even in the 70s, it was crazy for us up here, but not today, man. And I thought about you. I'm like, damn, he's right by the beach too. Bastard.
Today at 5 o'clock, I'm playing pickleball with my neighbors. So I'll
Love
think about you in my shorts and my short sleeve shirt. Don't worry.
it. I love it. I love it. Good. Well, I'll get you out of here real quick, but I want to ask one last question is this, just,
Okay.
what's, I always call it like, you type of docs and practitioners out there, that have this type of mindset, that have this type of practice and this type of, I'll even say heart, if you will, to do good for the patient. What's new in your toolbox? Because our toolboxes tend to be bigger.
Wow. We're always looking. I have a director of research, so we're always looking at the next question, and the next type of, materials and things. We have evolved even over the past year. We've added to our IV armamentarium. We're doing direct injections into things that we weren't doing the year before. We added the whole Hue Light suite, which is not just the that particular molecular hydrogen we use on every. And I'll tell you because it's kind of interesting. We
Yeah.
have a beautiful near infrared, and this material, this particular things, these instruments that come from Hue Light are made in Korea. They are probably the best of the best. When you put them side by side and you compare them, there's no question they are the best of the best, and that's probably for another podcast. But we have that shockwave therapy. We do have also the hyperbarics also from them, but this use of this hydrogen alongside of IV and alongside of the near infrared bed, which you go in, it closes down, and it literally gives the amount of infrared that if you were about 80% undressed, early in the morning in the sun, because that's where the infrared time, and also at the end of the day before the sun goes down. No one gets it. Animals do because they're outside, and you notice they never get burnt. They're much healthier. They're outside getting this infrared. It's the healing light. And infrared, if you have enough luminescence, which this does, it will push that light up to 4 inches deep into your body, actually through your skull, about 1.9 inches. So we put folks in there. We give them the molecular hydrogen to breathe in while they're in there. It is an amazing experience. And we use it in so many various disorders. Literally, it actually helps a heart attack victim heal quicker. It helps skin diseases. It helps the mitochondria. We use it in our cancer patients. I mean, I can go on and on. And that's what we're doing. We're combining therapies that are synergistic.
Yeah, that's key. I think the
And
synergy of all these things is so key that we notice too. That's beautiful.
that's the answer. Look, in my time, I've been doing this 44 years. You try to lay the ground so that the next group could do even better. I was trained, for example, in chelation therapy by the person that wrote the book. Now I still use it, but I use it with other things like these things we're talking about and other IVs, and I'm getting even better and better results. And I'm sure the ones that come after will too. The greatest thing that we're seeing now, Jim, is two. One, the physicians are becoming cognizant that they don't have all the answers. I'm sorry, I wish we did. And what the drug companies tell us, a lot of it's good, some of it may not, and some of it just doesn't work. We're also seeing the physicians say, you know what? When I do take CoQ10, like you were talking about in your patient, they did feel better when they were taking the drug. And basically, they are feeling better with these things that we're doing. The other thing is there is a massive um, awakening, acknowledgement from the lay people.
Yeah, I agree. Yeah,
People are sick and tired of being sick. They want this deep dive from doctors like yourself. They want to know what's happening in your biochemistry. What can I do to fix it, tweak it? I just don't want to take 5 medicines and still be in trouble 4, 5, 7, or 12 years from now.
yeah,
So that
yeah,
combination of the two, and I feel like I sit in a good place because I feel like I'm an integral part. I teach, and I teach for the postdoc pharmacists at one of the pharmacy schools and doctors, and you are too, and we are. I think that's the basic what our legacy should be.
yeah,
Push this
yeah,
to the hilt, get these things done. And folks, when someone tells you, yeah, what they're saying, there isn't a lot of information. That's not true. There's actually, if you look on PubMed, vitamin C, you'll see thousands of papers. What I told you about the approach to cancer, there are thousands of papers. And if they say, well, they're not good studies, we need to wait for more studies. Well, you wait, but you won't be here.
you
So,
won't be here, right?
so,
Yeah,
so
yeah,
go ahead. If there is very little side effect, start to look at doctors, integrative doctors like Jim. Start looking at the possibilities of your biochemistry and your physiology being whole. This
yeah, yeah,
scale yourself and fly to optimal health. And
yeah.
thank
No,
you so
no,
much for having me on.
no. Thank you. And you said stuff that is just so resonates with me in our practice, and obviously, probably I mimic you. Hopefully, not too much. I'll
Well,
get
I
you on the
still have
I'll get you on
hair.
the pip.
Maybe
What's
that's
that?
the
Yeah,
difference.
I know. I have. Yeah, yeah, yeah. I didn't like the side effects of that herb, so I said no. My wife, by the way, my wife years ago, she said, "Honey, just embrace it." So I shaved my head,
Good.
and we're still
Okay.
married. So
It's a good sign.
it's a good choice. Anyway, Mitch, God bless you, man. Thank you so much
Thank you.
for having this time cut into your day. I know you're super busy doing a lot of things, juggling a lot of things. I will see you in a few weeks. I'll be down in Florida. Obviously, I'll poke you and your knowledge, your expertise, but also your heart and your kindness. And I know you well, so I say that very deeply. I appreciate you. Dr. Mitch Ghen in Florida. You can message us actually, and we'll connect you if you need. Light USA. You can look that up. That's molecular hydrogen. And, here at the Deep Six, obviously we come from the 6-point model, always integrating these 6 points and because they're like a matrix. So, always think of and working on your gut health, your nutrients, hormones, toxins, mind-body connection, and structural issues. These are all important, and I think appreciating and valuing the importance of those is how we all thrive and how we all stay doing very, very well and doing good stuff. So again, thank you, Mitch. God bless you. I'll see you soon.
God
Take
bless
care.
you too.
We'll see you at the next episode of the Deep Six podcast.